Welcome to one of the most extraordinary chapters of your life, pregnancy. It is a phase full of change, excitement, and mystery. You probably may have just discovered that you're pregnant because, at 4 weeks, most women start noticing the early signs of pregnancy. Let's explore in this video what you can expect during this pivotal time, from symptoms and baby growth to vital do's and don'ts, sprinkled with tips to navigate this beautiful yet challenging phase. Week 4 marks the beginning of the embryonic period. The fertilized egg has made its way to your uterus, divided into 2 parts. One will become your baby, and the other, the placenta, your baby's lifeline. Genetic aspects. Your baby's genetic makeup, including its sex, is already determined at conception based on the chromosomes in the sperm and egg. Size and appearance. At week 4, your baby is about the size of a poppy seed or a tiny grain of rice, measuring approximately 1 to 2 millimeters long. And it is still very early, so your baby doesn't quite look like a baby yet. The embryo is a tiny ball of cells rapidly dividing and growing. Developmental milestones. During week 4, marked developmental changes include implantation, when the fertilized egg, or zygote, travels from the fallopian tube to the uterus and starts to implant into the uterine lining. The cluster of cells now divides into 2 parts. One part becomes the embryo, and the other forms the placenta, providing nourishment and oxygen to your baby throughout the pregnancy. The neural tube, which becomes the brain and spinal cord, also begins to form. Hence, adequate folic acid intake is crucial at this stage, as it helps prevent neural tube defects. Then, the amniotic sac, a fluid-filled sac that will cushion and protect your baby throughout the pregnancy, forms. Hormonal changes. By the end of the 4th week, the hormone human chorionic gonadotropin, HCG, is being produced. This hormone is what pregnancy tests detect to confirm pregnancy, and it plays a vital role in maintaining the pregnancy. At 4 weeks, numerous changes start in your body, even if the outside world can't see them yet. The early pregnancy symptoms are your body's way of signaling the start of something incredible. Fatigue. Surging hormones, especially progesterone, numerous metabolic activities, and increasing blood circulation to the fetus can leave you feeling unusually tired. At this time, you must listen to your body and note the changes within. To combat fatigue, take naps throughout the day and reduce extra workload so you don't feel extra stressed. Eat small, frequent meals throughout the day and maintain a well-balanced diet. Iron-rich foods like spinach or sweet potatoes also help boost your energy levels. Breast tenderness. Your breasts might feel tender or sore, especially around the areola and the nipple. It is due to hormonal changes as your body prepares for breastfeeding. A comfy and supportive bra is a great asset this period as it supports the breast and minimizes soreness. Gentle massages and warm compresses can also provide significant relief. Nausea and vomiting. This is one classical sign you might experience when you are 4 weeks pregnant. It's called morning sickness. Vomiting several times a day is perfectly normal, and it is primarily due to the increase in pregnancy hormones. Still, when you vomit excessively, like 4 to 8 times a day, you need to call your healthcare provider. To quell the nauseous feeling, take small, frequent meals so that you don't get hungry, pangs, and overeat, causing the urge to vomit. If you always feel like throwing up when you drink water, try taking water flavored with mint leaves, ginger, or a squeeze of lemon, as these can change the game from plain old water. And avoid anything like a particular smell that can trigger vomiting. Mild cramping and spotting. As the embryo implants into the uterine lining, some women experience light cramping and spotting. You don't have to feel scared if you have small blood spots in your undies. Clean up and use a panty liner. A warm bath or a heating pad set on low can help ease cramps. However, if you're concerned about the severity or duration of cramping and bleeding, consult your healthcare provider. 1. Do take prenatal vitamins. Folic acid is crucial now to prevent neural tube defects. Iron, calcium, and DHA are also essential. 2. Don't smoke or drink alcohol. These can lead to developmental problems and increase the risk of miscarriage and other complications. 3. Eat a balanced diet. Opt for whole grains, lean protein, fruits, vegetables, and dairy. Avoid raw meat and unpasteurized cheese, as these may be contaminated and affect your baby. 4. Don't overdo it. Listen to your body when exercising. Avoid high-impact sports and gentle activities like walking, light stretches, or prenatal yoga. At 4 weeks pregnant, you're at the start of a remarkable journey. While feeling overwhelmed by the changes and responsibilities is expected, remember to cherish this time. With the proper care for your baby and yourself, you'll navigate these early stages with confidence and excitement. Also, remember, every pregnancy is unique. Stay in regular contact with your healthcare provider to ensure the best care for you and your baby.